The flu season has definitely started. We're at 120 lab confirmed cases this year compared to 103, which is the 5-year season average.
A spike in flu numbers. Those are the latest stats from Toronto Public Health. A noticeably higher than average number of cases so far this season. So is it a sign of things to come?
What we do know is that typically as the holidays are approaching, usually by the end of December, the numbers tend to mount, and they tend to mount rapidly. And so as individuals are going to parties and as flu season is, as the virus is spreading, getting the vaccine now, this week, is good.
Last year was one of the worst flu seasons in over a decade. Dubé attributes the current spike to a potential earlier start in the flu season, but when pressed about whether the current number is alarming or an indicator of just how bad the season could get, she remained cautious.
It's really hard to predict which way flu is going to go every year. Usually we see 2 strains circulate in a season, and so right now we're seeing one strain, flu A, predominantly H1N1, that's circulating, and usually later on in the season we see a flu B strain that starts circulating, and so we can expect that to happen. The actual numbers, hard to predict right now, but to say, of course, it's coming.
She notes the current flu shot seems to be a good match to the H1N1 virus. She also says Toronto Public Health is prepared for however severe it may get.
We also, though, make sure that in long-term care homes, those individuals who are particularly at high risk, hospital staff as well, for example, that they get their vaccine. And we keep track of that. In facilities like nursing homes, if we have evidence of flu season and flu virus spreading there, we can offer antiviral medication to those staff and individuals to protect them further as well.
Now, a reminder, new this year is the high-dose vaccine available to seniors 65 years of age and older. It carries 4 times the amount of flu vaccine and is said to provide 20 to 25% more protection for the elderly. But reminder, there are some side effects that could last a little bit longer, including headaches, chills, and fever.